Welcome back. Have you ever read a news story about a crime and just thought, how the hell could somebody do that? I mean, are you constantly questioning? You read all sorts of things about all sorts of crimes and you just cannot work out how anyone could stab someone for 20 times or what have you. I'm just thinking of some of the things I've read in the newspaper today. Somebody who has to get inside the mind of a criminal, if you like, is my next guest. He's a consultant forensic psychiatrist who lives and works in London. Dr. 𝐏𝐬𝐲𝐜𝐡 Das is his name, and I just, when I read about him, I thought I've just got to find out more. Dr. Das, thank you so much for joining me. Like I said, a lot of people, a lot of us, most of us, I'd say, when we read these stories, cannot imagine what sort of person would perpetrate these crimes. Are there certain sorts of people who do, or could it be you, could it be me, could it just be anybody?
Very good question. Thank you so much for having me on, Trisha. So I suppose it goes back to the old adage of nature versus nurture, right? So if we talk about nature, there are definitely some personality traits, some characteristics that serial offenders have. So to be specific, they have a low tolerance for boredom. They can be quite impulsive. They can lack empathy. They can anger quickly. So they've got a short fuse. So those are all the kind of natural characteristics. And then there's obviously nurture. So it's the environment that we grow up in. And there's so many different elements to that. You know, it can be from poverty to homelessness to growing up amongst criminal peers. So, you know, if you're raised by a family of people that do crime for a living, or if you don't really have any particular family support and you drift towards gangs and then you feel like you have to offend to stay within the peer group. So there's lots of different factors. It's like a whole tumultuous range of different things that all contribute.
One of the things I've asked people who've offended and you know, often very violent crimes, I've always asked them the same question, and that is, what was the moment for that person, what was the moment where you thought, that's never going to happen to me again? Either I'll strike first or I'll do something never to get into that situation. They've always been surprised by that question and always thought back and had an answer, that there was something in their lives where they thought, I'm never going to be in that situation again. And it was kind of almost put to the back of their minds until a certain situation cropped up where they lashed out, struck out, or did whatever they needed to do to get their needs met.
Yeah, absolutely. So what I think you're talking about is trauma, right? Yeah. So it's a very uncomfortable truth, but it's a truth that I see day in, day out, that most people, most perpetrators of crime were once victims themselves in some form or another, whether it's, you know, abuse when they were a child or witnessing domestic abuse, for example, between their parents. So I think for these particular individuals, there's a power dynamic that's kind of entrenched into them, right? So they've seen since they were children that the way you deal with conflict is with your fists. You know, it's not through talking through your arguments, or they were themselves abused and they feel so helpless and victimized at that moment in time as children or as adolescents that, as you say, they make this decision, sometimes consciously, sometimes unconsciously, that life is hard, that people will mistreat me, and so I've got to preemptively be the one that is in control. I've got to be the one that dominates because I don't want to be a victim again.
Well, you're working with people who've committed awful crimes in many cases, and you have to sort of get to, I'm guessing, well, let me not suppose, what do you have to do? Get to know them, get to know what got them to where they are, whether they have a mental illness or a diagnosable one, or just have lousy mental health, if you know you know. How do you get, what do you do? What do you do?
So right now, I'm a forensic psychiatrist, as you know, but there's different types of forensic psychiatrists. So there's ones that work in prisons, there's some that work in secure units like Broadmoor, for example. Right now, I work as an expert witness. So what that means is that I will see a defendant who's already been arrested, charged, is usually on remand in prison, waiting for trial, anything from assaults to sexual assaults to attempted murder to murder. And my job is to decide, do they have a mental illness? Yes or no? Do they have symptoms at the time that they committed their offence? Yes or no? And if they did have symptoms, did that decrease their criminal culpability? So were they in control of their actions, as opposed to, for example, hearing voices or having paranoid delusions? And if they weren't criminally responsible, which I should say is only a very, very small minority of the cases, then I will transfer them or direct them to secure units rather than prison. So that's the basic essence of what my role is.
Can you talk about some of the cases that you might have had where the rest of us just can't understand? I think for many of us, we don't want our minds to go there. We can't let our minds go there. But what are some of the more notorious cases that you've dealt with?
Sure. Unfortunately, I can't name any of my
without naming people,
because of the doctor-patient confidentiality. But I'm happy to talk about it in general terms. So there's one patient that really stands out to me, and in my book I call her Yasmin. That's not her real name. So it's a absolutely tragic case. So she was an 18-year-old schoolgirl of previously very good character, never got into fights, never got into trouble with the police, wasn't antisocial at all, never had any kind of history of mental health problems. And then she became psychotic. So she started having these very strange delusional beliefs. And what she did was absolutely tragic. So she smothered and killed her 3-year-old nephew while she was babysitting him. Now, it goes without saying that that's the consequence of what she did was horrific. But I was convinced when I assessed her that it was related to mental illness, because she very clearly had these delusional beliefs that she was ridding this little boy of these demons that she believed was inside him, and that she could reincarnate him. So she had both paranoid and grandiose delusions. Upon my evidence, she, instead of having a life sentence in prison, which is what the CPS wanted, we transferred her over to a secure unit for long-term rehabilitation. So she stayed there for several years. She was given the medication that she needed, as well as the psychological support and family therapy. So
I was going to say, what happens when if you've got somebody who's done something while in a psychotic state, when they are, especially if they haven't been diagnosed before? And we should say, and I do want to say out there, and I'm sure you'll agree with me, it's not mentally ill people or people with mental illnesses aren't dangerous. I mean, they're most dangerous to themselves. I'm sure you'd agree with that. But in a situation with that, someone's got a psychosis, does something like this. What happens when they finally get the right medication and support and they realise what they've done?
Yeah, it's a very sad situation. So, yeah, I absolutely echo what you said, Trisha. The vast majority of people with mental illnesses are not dangerous, but the small proportion that are the ones that are seen by forensic psychiatrists such as myself. So Yasmin is a perfect example of this. So she was in our medium secure unit for about 3.5 years altogether. And for at least the first 18 months of those, she, despite the medication we gave her, her psychosis was still present. So it took literally that long before the medication, we got the medication exactly right to the right levels that would decrease these beliefs. And this wave of guilt and sadness, as you would expect, came over her. Because for those first 18 months, she didn't believe that she'd ended her nephew's life. It took that long for reality to seep in. And so we had to treat that, we had to treat it through intense therapy, including with her family members. So her brother, who's the father of the little boy that died, would sit in a room with her for 1 hour a week. I'd be there overseeing in the side. And they just had to reconnect that relationship. And she had to get her head around it, for want of a better word, with the help and support of our team.
Yeah, but there's guilt everywhere, because especially if psychosis almost seems to, quote-unquote, come out of nowhere, everyone's saying, why didn't we notice? Why didn't we see the changes? So, I mean, none of these things happen in a vacuum. They affect many people. What about the people who, right at the last minute, say, oh, I can't, for some awful crime, say, oh, no, I can't remember doing that, I had a mental illness. What about the people who, in your mind, feign mental illness? Can people fool you?
I'd like to think not. I do think that I see people who try and exaggerate or feign symptoms of mental illness relatively regularly, maybe every 2 or 3 months. Yep. And I have to say, Trisha, it's actually very easy to spot them, and I'll explain why. Firstly, because in Yasmin's case, she became psychotic very quickly, but that's exceptionally rare. Right. The vast majority of the time, 95% of the time, that it's a slow build-up over many months and years. So if somebody who I'm assessing for a criminal trial tells me that they're hearing voices, for example, I look back at all of the evidence. So I look at their medical notes, I look at the witness statements for people that were around, possibly of the victim, the police transcripts when they were interviewed. So they're telling me that they're, psychotic, that they've got these symptoms, but they're appearing normal in all the other objective evidence, then I'm slightly suspicious. And the other thing I'd say is that people in general are not very good at faking mental illness, because if you're genuinely psychotic and you're genuinely paranoid, you're not going to tell me.
You're going to try and hide it.
Absolutely. If you think people are watching you, are out to hurt you, you'd probably think the same of me if you met me for the first time. So I found in my experience that the ones who are truly mentally ill, they're very guarded, they're very evasive, and it's quite hard to elicit those symptoms. Whereas the ones who have an agenda, the ones who are faking it, they try right from the beginning to convince me a bit too hard.
So here's a big question. Doing what you do you believe in evil? Do you believe some people, have you ever come across someone where for all of your training, everything you know, you just think, no, this person is evil?
Yes, I wouldn't ever use the term evil, like in giving my formal evidence, but I would use the term antisocial personality disorder, or even psychopathy, so psychopaths. So on one end of the spectrum of the clients that I see, the defendants that I see, some of them have pure mental illness, like that young girl that I keep talking about, like schizophrenia, they hear voices. Yeah. And on the other end of the spectrum, you get people who have a personality disorder. So that's not a mental illness in that it's not a change in their baseline, but they naturally have a type of aggressive personality. So they don't care about the law. They don't care about the rights and wrongs of other people. They are impulsive. They are aggressive. These are like lifelong, thugs, drug dealers.
And again, we should say that not everybody with a personality disorder is like that, but the ones you're talking about obviously have had that nature, that nurture, the whole shebang thrown into a situation that would be naturally volatile for them.
Yeah, and there's lots of different types of personality disorders, as I'm sure you know. But the one that I see the most commonly is antisocial personality disorder. So those people with those traits that I just talked about, almost by definition, are more likely to offend. Yeah,
and so for you, I mean, is everybody savable? That's the other thing. The death penalty often comes up in discussions. Have you ever would you ever support a death penalty knowing what you know?
That's a tricky question. I think I would not support the death penalty in the vast majority of cases. So almost everyone that I see, if they have a pure mental illness, then absolutely not. They can, in theory, be medicated, can be treated. If they are a clinical psychopath, if they're, a nasty, hostile person, then I still think there is a chance of redemption. Treating somebody with a personality disorder is very, very difficult. It takes years and years of therapy. If they were in control of their actions, that therapy, in my view, should be done in a prison setting. They shouldn't be transferred over to
But you said almost. You said not everyone. You said almost. So are there some exceptions where you think if the death penalty was around, you wouldn't be the one trying to stop it?
I think so, yeah. In exceptionally rare cases, when I've seen in my career, maybe 1 or 2% of the defendants that I've seen are serial offenders who clearly don't want to change, who've been given ample opportunity to change. I've assessed people who have killed multiple times. I've assessed people who've committed sexual assaults multiple times, and you can just tell by your interactions with them that they have there's no hope. They don't want. There's no kind of inner motivation or epiphany for them to change. I'd say in that exceptionally small, rare case, I would support the death penalty.
Wow. Dr. 𝐏𝐬𝐲𝐻𝐷 Das, thank you so much for joining me. I do hope you'll join me again, because it is a fascinating subject, and often there are cases and I want to look beyond the headlines there. Consultant Forensic Psychiatrist Dr. 𝐏𝐬𝐲𝐻𝐷 Das. I should get his name right.